So today we're going to go through our theme, right, of social, environmental, and economic for our symposium. So from a social perspective, there are 2 million open jobs in healthcare, 1 million in nursing. We know that our education system produces 100,000 nurses a year. How does your institution deal with that dynamic of decreasing availability of the workforce?
The number of nurses in this country are essentially fixed. The nursing schools could expand as much as they want to, but that is a 6-year timeline. Let's just be honest about it. And when you look at what I'm going to call the tertiary quaternary care centers, like Rich and I have, you get really, really concerned because you need actual nurses at the bedside, in the ICUs, and in the step-down units and in the surgical areas. One of our ways out of this that we are aggressively testing and aggressively working through is, how do we deal with human-based virtual nursing? So take the TVs in the room, make them two-way, make the ability to communicate, but in a command center, put very experienced nurses who can jump into the room, do a lot of the routine stuff, how to take a history, how to deal with medication reconciliation, how to provide assistance to the younger nurses who are on the floor. When you do that, you all of a sudden are being able to substitute a nurse that instead of 1 nurse for every 6 rooms, just as an example, you can take that floor nurse and expand them to 1 nurse every 10 rooms, while you have this backup support that can take off the easy things. The other thing we have to do in this country is we have to begin more to look at the ladder. How are we going to use LPNs? How are we going to use care partners? Those are things that are really unpopular with patients, but it is the only way out of this conundrum that we have right now.
Yes, there's not enough nurses that are coming out, and there's a whole other talk on that. However, there are enough nurses to meet the demands that we have at VJC. So therefore, what are we doing in our environment? And so we focus a lot on belonging. Yes, we call it radical flexibility. You know, how do we create things so that the individual member of our team has flexibility to pick a schedule, get paid when they want to get paid. But what else are we doing to support them, the whole them, in the environment where they spend most of their waking hours? And so everything from mental health to physical health to spiritual health, a lot of team-based efforts. And then making sure our frontline people managers have the tools and capabilities to engage so that we become more engaging and therefore more attractive to our competitors in the local marketplace.
I think, the issue at top of the license is a little bit of tribal warfare, to be honest with you. And getting everybody to the same place, I actually think the pandemic helped us a bit. Because in Tennessee, after a lot of work, we got to a place where medical assistants could give vaccinations. You would think that that was changing the Constitution. But we got there, but once it was done, the nurses were like, okay, I don't have to give vaccinations anymore. I can send someone down to the vaccination center and a medical assistant can do it. But it's a little bit of trench warfare to get the culture over, and the people at the top of the food chain, the MDs, have to really, really get on board and do the trust walk up and down the ladder of the staff competencies. Yeah, we've had a lot of the same things. In 2016, Vanderbilt University and the Medical Center separated, so we're 2 distinct organizations. The difference between us and BJC is we actually employ the doctors. So during the pandemic, we actually fairly strictly controlled MD salaries. But we got slaughtered, and I wish it was only 30%, on what we had to give out for salary adjustments or base comp adjustments to the nurses, the surgical techs, all up and down the line, including the EVS staff. And that's really where we got. And the third-party payers have no patience for reimbursing this rather significant cost increase that we've had. And that's going to become a really big problem for everyone who's trying to get health insurance for their employees, because this is going to be a real problem between what employers want to pay and what the hospital costs are. Rough, tough, and I'm going to blend a little bit of the numbers. We cross-subsidize about $200 million a year in MD education, resident training, and the research mission.
So you're at 30%, I like wish it was $200 million.
You're right, yeah. If you just hire your own doctors, it's easy. Get rid of that pesky other problem. And the residents are really important to this state. So we draw residents from national now, right? A lot of residents come from the Northeast and California to train here for 3, 4, 5, 6, 7 years. And roughly 50% of those residents remain in Tennessee. So if that training program goes away, if everybody in this state thinks that there is currently a rural health problem, batten down the hatches. Because the rural health problem will get a lot worse. And then when that all crashes and burns, the larger centers are just going to be under more pressure with margins that we can't exist on. You know, how many of you would invest in a company where a 6% EBITDA is considered a victory in any one year? Okay? That's effectively what we're living in. And when we talk to our board members, they go, ooh, glad this is a not-for-profit because we don't want to invest in it. But that's where it is. And many of us are the only place where you can get very tertiary and quaternary care in the regions that we are. And so this is going to be a looming crisis. How many of you own companies? How many of you don't like any increases in your health care cost? You're part of the problem.
Let me do a follow-up to this, because Rich, you mentioned on a local basis the third-party players coming in and some of the antics that they were using. I want to broaden it a little bit, and we'll see where this potentially could go. I'm on a couple of national committees, and when we try to tackle these big issues, and some of them you've actually described, it's not just local, it's national as well, even that problem person up there. But, I mean, we're trying to just find forums to where we can do something that's called collaboration, or at least it's identify what the main issues are. Is there anything, because you've addressed a little bit locally, but is there anything going on in the healthcare industry that says, why don't we just quit talking about the problem and start addressing the problem in any way? Are we so diverse as healthcare we can't do it?
I think as a country we're so divided, and you know, and healthcare is a highly regulated industry, and so it's going to require support, cooperation from our elected officials at the federal level that gets trickled down.
I think as a country, we have to figure out what we want from healthcare. And we are not even close to that. You know, the dean was talking about manufacturing and doing small manufacturing. Okay, some of these drugs are $2 to $3 million a year drugs. Whether you're over 65 or whether you're a child covered by the CHIPS program, or whether you're just an employee covered by a third-party payer. When a hospital goes back to your insurance company and says it's $2 to $3 million a shot a year. Those of you who own companies, what are you going to say? Pay or not pay? Because you can't lay it on the backs of the hospitals to pick that up as uncompensated care. That's not a viable place to be. And as the country races with more and more people turning 65, that bill is going to get a lot larger, and effectively on a good day we break even on Medicare on a good day. Most days we lose money. So this is all careening towards a collision someplace, sometime.
Who's going to lift this up? Now I'm getting depressed.
Our offices are designed for bad news all day long, sorry.
I think one of the things this forum does is hopefully it finds either solutions or shared solutions, or becomes hopefully a generating point of trying to search for them too.
Yeah.
So, and sometimes asking the hard questions, it's in an effort to say, can we ever get together and figure out something?
Okay, so I'm going to push this all back on all of the engineers and all the retired engineers who sit on committees that set standards for how big the room has to be and how big the hallways have to be. And because you put retired engineers and architects on there, they love to make the rooms bigger. Then Joint Commission comes around and says you have to have bigger rooms, and that all increases the cost. What does a bigger room have to do with delivering quality health care? Interesting question. But that's part of the problem that you all bring to the table.
So everybody clapping. It's probably not an engineer or a contractor.
Right, yeah, I know. Or an architect.
All right, okay, we're gonna go to
Dead silence.
environmental, because this is gonna boomerang right into the economic conversation, which I don't know that any of these are void of the economic pieces and components, right? So we will, and the question that we put together for environmental is, what role do you see that sustainability plays in recruiting and retaining new talent in the healthcare field?
At the end of the day, it's all about base comp. I mean, yeah, there's a small cohort of people who are very passionate about it, but at the end of the day, it is just about base comp. And, you know, if we're a little bit honest about it, we all try to do plastic recycling. How much of that just goes to the landfill, folks? At the end of the day, you know, talk about being the most unpopular person. There was a meeting about recycling, and I said, if we really want to recycle, folks, let's get rid of all plastic bottles, turn them into aluminum cans, because that's the only thing that effectively has a market. And talk to your suppliers when you say, we want plastic bottles out of here, and we want to go to aluminum cans for water and all that stuff. It's a challenge, but the vast majority of employees aren't there. It's all about base comp.
So,
Well, challenge.
I guess we're uplifting today. Yeah, right. The efforts that we do as we're tearing down buildings and construction waste do have benefit. But that's relatively small in our whole scheme of spend. And you know, not to leave the wrong impression on the tape, we certainly all, as we're doing renovations and replacement of air handlers, et cetera, do the best we can afford at energy efficiency.